Okay, welcome everyone to the Innovators Mindset. I have Jinesh Patel here with me. Thanks for doing this on such short notice, Jinesh. Really appreciate it.
Yeah, thanks, Vic. Thanks for having me.
So you created a tool called Teletech. Talk to me about first of all, what Uptime is, what you do in general for the audience, and then what was the challenge that you saw? What did you see out there that led to this?
Sure. So Uptime Health, we automate compliance for outpatient healthcare facilities. If it's your daily, weekly, monthly QC task, how you manage all the equipment inside of your building. And with the last thing we also added was a technician marketplace for people to do the maintenance and service work on those equipment for outpatient facilities. The whole goal is to try and automate things that aren't in their wheelhouse and save them money.
Yeah, so your tool tells me something needs maintenance, and then the next thing is, well, who's going to do that maintenance? So, yeah.
Right. Sometimes you'll have manufacturer contracts or service contracts, but sometimes you want a better, cheaper, faster option. And we're exposing a market that allows for that. This market's really never been marketable, or there's no real place to search for these people. And so that's what we created on that.
Yeah. So that's pre-COVID-19.
Yeah.
And then over the last 60 days, what did you notice out there? What were you thinking about?
Well, we noticed a couple things. One, the number of outpatient facilities that were serving a population they probably never served before increased dramatically. People now with this really serious condition were walking into urgent care, so they changed how they operate altogether. And the other thing that we noticed is a lot of different devices were now being used in different places. So ventilators are being spread across the country to get them in the hands of people who need them and use them. New analyzers are coming out every day by Abbott. I know they created that 5-minute tester. In general,
and the training, there was no training time. They just throw the device in and say, okay, start using it.
Yeah, and also these devices aren't built to run 24/7 either. They break down and they need maintenance and repair. And now more than ever, every ventilator that's down is a patient that doesn't have one.
Yeah.
And there's a large number of ventilator techs, but there's not enough to service the amount of repairs that are going on right now. But what we also noticed is we talked to our technician marketplace, and we found many of them are, out of work at some level because half their jobs were servicing surgical centers, which are closed with ASCs and elective surgeries kind of taking a big hit. And so they needed work, but they also had the skills and expertise to help these people that need their equipment up and running. So the hard part was, how do you connect these individuals, and how do you do that in a remote fashion that allows people to really get the help they need in an immediate time frame? And the goal is, if we can connect experts that can actually help put together a medical device and get it maintenance and repaired remotely, that's potentially a device that goes back up and running and servicing a patient faster. So that was a challenge.
You might get back online in 40 minutes as opposed to 4 days.
Yeah, because before, if you didn't do it remotely, you had to factor in travel time. Just the commute itself between yourself and the facility, that's time. And every minute you're on that road is a minute you're not serving another client. And then also, just the amount of effort it takes to do all that and go out there and then triage and then see, okay, I need this part, this tool.
Yeah.
It's just a longer process than it needs to be at some times. Now, there are times that you actually do need to go out there, but we want to make sure if people are actually going out there and exposing themselves to these coronavirus environments and they're older in age, it has to make sense for that to happen.
Yeah.
And so we also want to validate the need for them to go out. So there's a whole secondary issue of make sure you're putting yourselves in harm's way only if it's absolutely required. And then also, can we get more machines up and running from a technician standpoint?
Okay, so what did you put together? How did you approach it?
Yeah, so we started seeing the industry move towards telemedicine and everything, and virtual health was just becoming more, accepted in healthcare. And one thing that we didn't see happen was anyone develop a tool for technicians and helping them, do things virtually as well. Because just like if you were using phone support before and someone was walking you over the phone, hey, Vic, your computer's down, can you restart it for me and make sure it's absolutely broken before I come out there? If they were able to visually do that and watch you click the buttons you clicked and make sure you went through the processes and protocols before they came out there, or maybe even walk you through a sophisticated repair via video, then I think it would solve, a lot more problems than them just assuming you did what they asked and then going out there. So our goal was, how do we put video in front of technicians then how do we power that video tool to give them extra features that they need that they won't find in a Zoom conference or a FaceTime? So we give them things like pointers, so they can point on the screen and you can see what they're pointing at. So if you're holding your phone up to that device, you can see that they're pointing at that device and that button. So it's like, click that button for me, Vic, and then they actually know that you've clicked the right button.
Okay.
We also have markups, which you might see in other video tools like Zoom, but they can draw on the actual screen, maybe show arrows as to how to flip a panel or do some certain activity. They can also OCR things. So another big problem when it comes to medical equipment is long serial codes and part numbers. And so calling those out over the phone or trying to read that while someone's wobbling their camera, we also allow them to do OCR on the video. So it pulls out these really important data points. They can throw it into their database at their home or their laptop, quickly find that serial number, that part code, and then relay information back.
Yeah.
There's a lot of things that, just standard video doesn't actually accomplish. And so we just needed to add these additional tools to the video.
Yeah.
And so,
so what was the time frame? Like how did it come together? What was the team that you put on it?
Yeah, so we went from idea phase of 2.5 weeks ago to finding the right tools, the underlying technology, finding some other partners that might have already built some small capabilities, mashing it all together, and getting it out into our marketplace. And that took a total of 2 weeks.
Yeah, wow. And so it's live. Is it live now?
It's live now. As of last week, we did a soft launch with 5 technician groups that we have good relationships with. Every single one of them moved to either meeting with the decision maker or have signed just a free trial just to start using.
Yeah, excellent. So what I'm finding, because I've done several of these, is that lots of people are contributing and partnering and helping each other. And it sounds like you found that a little bit where you reached out to other people and they had pieces of technology that then you could stitch together.
Right. Yeah. And we actually looked out for that first before we went and started reinventing the wheel. We tried to see who already kind of was halfway there and we could repurpose for our use. Yeah. And we found some other startups, which is one thing that we were really looking for, is helping other startups in this ecosystem. And so they were already tackling a similar issue in a different industry. And we're like, let's do this. Let's rebuild it and purpose it for healthcare. And they were all on board. And so they really helped us spin this up faster than probably would have taken if we built it from ground zero.
Yeah. Excellent. That's great. And so tell me where you think this could go. Like after COVID, I think it still could be useful as like a part of the technology, because technicians are in short supply even in good times. And so it may be an ongoing tool, do you think?
Yeah, I think a couple things come out from this. We made sure that when we were developing it still matches our North Star, which is help facilities with equipment uptime and compliance. And at the end of the day, if someone's able to remotely walk you through a repair via video, and they're able to put that machine up and running 2 days faster than to have that you waited for them to physically come out there, we've accomplished our goal. And we've actually saved time and money on the technician's part. There's no travel time, there's no gas cost, there's no sunk cost with just going out there and not bringing the right tool the first time. So we think technicians—
their capacity to do more, they probably can do more jobs.
Yeah, exactly. I think they'll do more jobs, more devices will be up and running, and I think they'll start using this tool as a first response triaging tool to make sure if they need a more severe response, like going out there buying parts, that they've at least seen it some way, shape, or form before they're just guessing and checking.
Yeah. Excellent. Well, thanks for walking me through it. Where can people learn more about it? Is there a website or something they should hit to learn more?
Yeah. So on our website, it's uptimehealth.com. And on the solutions page, there is a product called Teletech. And if you go there, it'll walk you through some information about why healthcare facilities will really need this right now, how technicians can sign up. And then if you're looking for on-demand help, if you're a facility, we actually are allowing them to just fill out a form, and then we'll go to our technicians and say, can you help this person fix their ventilator right now? And we have some vent techs standing by that we're willing to do that for us.
Okay, so uptimehealth.com, and then it's Teletech is the product.
Yes.
Okay. Great. Well, Jinesh, thank you for this. It's been really great. I'm excited to see how it grows and evolves in the marketplace.
Of course. Appreciate it, Vic. Thanks.
Yeah.